When I saw the x-ray, I shit myself a little bit. At first, I was like, whoa, welcome guys. This is my house. We have the one and only legend, Dr. Dan Holtzclaw in the house. Thank you for coming. There was a case today. I needed help. Who would I call other than the man himself? I saw this lady about a month ago. When I saw the x-ray, I shit myself a little bit. At first, I was like, whoa, there's not much bone to put. There's nothing. She told me I've had 3 different surgeons, periodontists, oral surgeons work on me doing bone grafting and nothing worked. Can you help me? When I saw the x-ray and I saw the width and the length and the height of the cheekbone of hers, it's definitely one of those that made me feel like, man, can I even fit 2 next to each other without hurting her orbit or her eye and then going back to this area which we don't want to play with. At the same time that I was thinking about all of this, I had another patient who was there for the post-op after 2 years of getting the same kind of quad zygo. She's there, this is a new patient. Now they're talking, telling this new lady, you need to do it. Next thing you know, I'm like, you know what? I need somebody here to put me into this place where I can understand, maybe use the technique, the hand movements a little differently than what I've been used to. I called my friend, my good mentor. Ultimately, he was here today to guide me, and that's why, because of him, we have another patient, smile restored. So thank you again. I appreciate you coming. I owe this man so much gratitude because of what he taught me that is possible. He's the man who really coined that pterygoid and Patzi and so many different protocols that nowadays people all across the world are honestly using it. His book is on Amazon, top 50,000 in the dental world.
No, out of all books, I think there's 32 million books on Amazon. It's gotten as high as 19,000, I think. I didn't even know if anybody would want to buy anything like that. I just said, you know, it'd be good to have the information out there.
Yeah, it's like a cookbook. You can open it and understand it. It's just very straightforward. When I'm reading it, I feel like I'm actually watching you do it and listening to you do it. So I think that's also part of the reason that it's been keep buying more. It's because it's relatable, it's understandable, even for folks that don't do it. I get so many DMs from general dentists or dental students 4th year applying or about to apply, and they say, I am really wanting to do what you do, or I want to get into this world. Do I need to go through residency? You're a specialist. Of course, you've gone through the whole residency. So how do you feel about it now?
You know, times have changed so much. It used to be that way. If you wanted to do implants,
sure,
you know, you had to either do oral surgery or perio.
Yeah.
Now, you know, there's so much education out there, good quality education. You know, you can do just as good or better work.
And talk about that.
A lot of people love implants. And if you want to do implants, it's not going to hurt you to do residency.
Sure.
Do you have to? I don't think you have to anymore. There's so many continuing education courses out there.
Yeah.
The thing is, people need to pace themselves. You do have people, they're taking Implants 101, and then they want to jump straight to All-on-4 and Zygos.
So good. That is what you just said, is what I was going to talk about, the weekend warriors. The people that think they're just going to take a weekend course, 2-3 days, and jump back on Monday and do a full arch. Don't think that I'm just going to go do a course and come back and do a full arch because it is guided or because the lab is making everything for me. I think you still need a lot of singles under your belt. You need a lot of way of flapping and extraction and tissue stuff that where you know now you're just doing it 4 times more.
I hear this all the time. Well, I've placed, you know, 100 implants, or I've placed, you know, 500 implants. You know, you have single unit implants.
Yeah.
And then you've got All-on-4s, which is completely different thought process, mindset. And then you have remote anchorage cases, which is another different type of mindset. They all involve implants. The thought processes are all completely different. And then even just doing them and getting experience.
Yeah.
You have knowledge, and then you have wisdom. Knowledge from taking the course, then you have to put it into practice. So then you do things right, you do things wrong, and now your knowledge turns to wisdom. I mean, I very specifically remember saying, I will never do a zygo. You'll poke someone's eye out. I had done, I don't know, probably like 500 arches before I even thought about doing a zygo. I think you have to pace yourself and know what you're really capable of or not capable of. Whenever I'm doing something, I always want to think, if this goes in front of a board, can I talk about and defend what I'm doing?
I mean, I also think that part of it is some people start this journey and go quickly. The pressure from social media is driving a lot of that. Deep down, some of that complications leave you not wanting to even touch implants and do surgery again. It leaves that taste in your mouth. It's almost like a trauma that you're like, man, I don't want to ever do that again. And if this is a game that you really truly enjoy being and doing for a long time and staying in the game for a very long time, then it's very important to, like you said, pace yourself.
What's nice is having a group of mentors. For this case, you gave me a call and said, hey, you know, can you come over? I've even got, you know, a group of friends I consider mentors, and, you know, we talk and share ideas and discuss cases.
It's the power of friendship too.
Yeah, it's nice.
They don't teach you in school how to be a good friend.
For whatever reason in dentistry, there's competition of who can throw more people under the bus. People will have a case come into their office that another dentist treated, and maybe the work's say not the best or whatever. These doctors are just like, oh my gosh, that guy did a terrible job.
Yeah.
You know, that's garbage work.
I think it's the insecurities going through the day-to-day drama in their offices. And this is now an opportunity that I can actually be better than somebody else. Those people, I feel sad.
I have blocked a number of people on social media because they just have nothing good. It's just, they're so negative. Yeah. Even if a patient comes in and I see work, you know, that's not good, telling the patient is like, you know, I really don't know the situation the doctor was in. You know, I could tell you is what I see, and, you know, we have to make some changes. I'm not gonna throw the other doctor under the bus or anything of that nature.
Every single case that I'll have this thing, it's almost like it's hacked in my brain, and it comes out when I have a patient asking me about how did my other doctor do based on when I'm looking at their x-ray. I say, I wasn't there to see the circumstances at the time of this implant being placed or when you saw. So maybe they did their best, maybe they didn't. But when I say that, they automatically start nodding, knowing that, okay, that's living the past. Let's now work, this is a present. 2 days ago, I had a patient, so funny. I don't know how many thousands she paid in for this bridge that was sitting on 4 teeth. She has it's an 8-unit span bridge. 4 teeth she has left, abutment teeth. And it lasted 2.5 years. She was so mad. You know how when they bring that anger to you now, like somehow you're also responsible because it's your colleague or somebody. She was wanting me to guarantee if I do the implants that she's not gonna have that problem. So I tell her, I said, I'm a human. So I totally understand where that frustration comes from, where you're getting that anger from, because it is unfortunately unfair for you to pay that much and go through this. So I get where you're coming from. But also on my hand, I just met you. I'm gonna guarantee you that I will do my best.
Now that All on 4 has been around for, you know, 25 years, some of these longer term studies are showing, you know, there's bone loss, and it's not because anything was done wrong. It's just that is what happens over time. Patient now goes into a dentist, and the first thing the dentist says is, oh my gosh, this is terrible. You have threads showing. You know, this dentist did a terrible job. But the literature shows us that's going to happen on these cases as they get older. For example, what you did today. You know, this lady had bridges in the past, you know, root canals, bone grafts from multiple different surgeons. None of it worked. She had spent, you know, tons of money on all of these dentistry, and now she, you know, is basically at the last resort. I told her today when she woke up, she says, oh, well, is this gonna last? And I said, well, hopefully they're gonna find you in 1,000 years and these will still be in your head. So she's like, oh, good.
Talk a little bit about mental health. One of the most recognizable things about you was that during surgery, you did not once showed, I mean, I'm sure inside may have been different, but outside was calm ocean. I feel like it's not something that you were born with that way. It was probably something that you gained more and more over time. So I like to know this wisdom, because when I look at you and I see myself my age and I'm like, man, can I even make it and be able to do what he's doing at that age?
For me, you know, developing, you know, very thick skin was helpful. Been studying actually a lot of Buddhism. I do a lot of meditation.
That's awesome.
So that helped a lot. Playing music, and I always, so like I made these playlists on Spotify. Even when I'm in other offices, like if I go do a surgery in another office, I gotta listen to my music. The other thing is I sit for all the surgeries. For your long-term career,
That's another.
probably helpful.
Yes. Being able to feel comfortable, sit down, relaxing, and taking care of yourself. Those are the things that go a long way.
Yeah. What do you like to do to relax?
As soon as I slowly start getting agitated and anxious and worry, I know that I'm in my distress mode. The moment you recognize the fact that you're not doing well is the beginning of you slowly start feeling better. And then after that, I usually do some nice deep breath, like kind of deep breath through the nose and just come out of the mouth. And some of those deep inhalation, exhale. When I'm done with the surgery, I used to be so anxious after surgery. I have a bunch of other stuff to do. It's either delivery zirconias, scans, or post-ops, or seeing new patients. So what I done is like going into my room, putting either the headphones on or some sort of an ambient or noise canceling sound, and just calm down and pace myself. I think if you notice, especially with a lot of doctors, they are living in that fight or flight zone so much. They're not as calm. They're very quick to react and lash out. If you don't recognize it, you're not gonna enjoy doing this stuff. Any interest in do nerve lateralization, the
No.
movement, or anything on the mandible that you want to like do some challenging stuff on the mandible?
No, and I'll tell you why. If you're doing nerve lateralization, you are going to have paresthesia or anesthesia, whether it's temporary, permanent, whatever. You know, they're higher risk procedures.
Sure.
You know, to be honest, I just don't want to deal with any of that risk.
What led you to where you were like, okay, I want to start doing either pterygoid or zygote, and I'm not sure which one you started first to get more familiar with?
I actually started doing pterygoids first. You know, there was no instruction on pterygoids. I literally just read about them and said, I think that would be helpful. And I just did one day.
Yeah.
Unfortunately, it worked. Otherwise, maybe I wouldn't have ever done
Sure.
another one. And then also I would do big sinus grafts or bone grafts, and sometimes they would work, sometimes they wouldn't work. And I had to turn patients away sometimes, like I can't help you. And then sometimes you have a case, you know, that has a failed implant, and the only way to fix it is maybe a zygo. You know, we started incorporating zygos into the office. And then as we got more skilled with them and more comfortable, you know, obviously we started doing more challenging cases. And I think teaching has helped a lot to explain it to people, to make it digestible and understandable. It also helps me too, because you may have a question that I never thought about. I wish, you know, I had somebody to tell me to do this back then.
Yeah.
And now it seems like, oh, well, of course, everybody knows that. It's like, well, everybody knows it now,
Yeah.
but everybody didn't know that then.
Back then, yeah.
You know, it's like, well, why didn't you engage the nasal rim to get better torque? Using the pencil, I mean, I think the pencil is one of the most important tools.
Absolutely.
You learn and you grow, and
Sure.
you take courses and people teach things. I think it depends, you know, also on your practice. So like, for example, you know, everybody's practice is so different.
Yeah.
Your practice develops a personality, and then as time goes on, it gets known for certain procedures, and you
Sure.
tend to specialize in those procedures. And you know, it could be a general dentist practice that's, you know, we specialize in crowns, or we specialize in veneers, or
I mean, this is a new one that I'm actually excited about. I don't know how much you know about it, but the Ray, give a little shout out. Ray printers have this onyx tough material, which is a very thin resin, and it's great strength, very strong. But also it comes with prepless veneers. What they're doing is now trying to do prepless veneers with this printed, but instead of charging $1,500 to $2,000 per veneer, you charge about $700, $800, and you bond it with resin. Like, to me, where I'm in this whole full arch world and I see that, it gets me excited, and I'm like, man, there's avenue. I think as a general dentist right now, if you're getting out of school and you feel like what genre I want to get into and make a lot of money, they're either cosmetic dentistry or implant dentistry, as long as you're still enjoying doing those procedures. But cosmetic dentistry is also exciting because of the 3D printing world and the veneers and things you could do with the AI design, as well as the full arch, always with the full arch world, which, like you said, everybody's going to be doing it more and more.
which will be a blessing and a curse. Just with more competition, it's going to drive prices down, which has already been happening.
Yeah.
There's also going to be more complications to fix. I wanted to say you did a great job today.
Well, thank
and
you.
that lady, you know, that patient was very, very happy.
Thank
And
you.
especially I think about all the things that she went through, like all those past bone grafts.
Yeah.
That, I mean, she had all
Could
this
see some of that
grafts.
granules.
You could see it. And then she still had no bone.
Yeah.
Even though she went through all that grafting, and there were still all those pins in there and screws.
Yeah.
When you opened the hood, you pulled the gums back, there was no bone there.
Nothing. I think another thing that you showed me was awesome was the cutting the fibers with the laser was allowing me to see a lot base of the zygote
Oh yeah, the tendon.
so much nicer, so where I can now have more real estate. Because otherwise, if that covered it,
Right.
which sometimes in zygote I feel like you might have to have it covered.
But I think the one thing I would say that we talked about earlier is if you do learn like Zaga style or you learn like a pure extramaxillary approach, I think it's important to not mix some of the
Yeah.
parts, because what I find is when I see people that start mixing the parts, it's almost like it makes it worse.
Yeah.
I see some people sometimes get into trouble with that. So I'd say like if you're gonna do Zaga, like do Zaga. If you're gonna do like a pure extramaxillary, you know, do that, and because if you're mixing them,
Trying to use multiple techniques might be a little bit challenging, and that's why it's best to just kind of settle or try to do one and mastering it, and then the other mastering it. And I think mostly the more important thing is with every single one, knowing where you are, get your probe and know where you are, where you're going, and just chill and slow down and just keep practicing and getting it. So just to wrap this up, I asked Dan to come to the house to do this recording, and thank you for you guys watching. There's going to be a series of these nice videos we're going to do, maybe podcast version style, I don't know, but I hope you guys got a lot out of this. Again, Peyray out.